When we're dealing with scoliosis, we'd actually like to find out what is the Cobb angle measurement. It's measured in degrees, and how do we go about doing that? And is it a reliable measurement? Well, yes, it can be. These sort of postural photos here aren't good enough, but they do give you a guide in between x-rays, and the eye is actually an important measuring tool. What you can take a look at is waist, shoulders, shoulder blades, and also the angulation of the spine itself. And this young lady here on the left and this one here on the right hand side have 57 and 54 degree or 52 degree scolioses now as well. And this is actually what it looks like on an x-ray. So the x-ray is largely useful for determining effectiveness of care. But when you've got something like rapid scoliosis which is progressing, x-rays are often used as the justification for doing surgery. And regardless of whether this curve here, which started out on the 25th of April and then progressed to the 23rd of May, and then also in here the 10th of June, you'll see here that the curve has actually dropped from 25th of April to the 23rd of May, 66, 62, 57 degrees to the 10th of June. Well, x-rays become valuable, very important with regards to where is the reduction taking place and how effective is the treatment. Now, what we want to do is talk about the reliability now of the x-rays, and invariably practitioners either get sloppy or they don't understand the importance of x-rays with regards to ongoing care. And the reason for that is people don't really believe that scoliosis can be addressed in a non-surgical way. Well, look, the x-rays prove it. So what we want to do is highlight the importance of this to practitioners as to why x-rays can be useful and why it's really important to measure them properly, because we don't want bad information going to patients and or their parents. Now in this situation in here, the angle that's created from the green line to the green line down in here is known as the Cobb angle, but this top green line is incorrect. It should actually be where the golden line is, and you can see how both lines vary in their angulation. So what turned out to be recorded as a 60-degree curve was amended in this report here. So the 60 degrees here was then later revised down to a 51.8 degrees. And what a shock that is for any person and parent, anybody associated with the scoliosis treatment. What a shock that is to know that, oh my gosh, the curve's gone to 60 degrees. Well, that's not really the case when you do the angles properly. So we do want you to be informed and empowered in your measuring of curves, and you've got to understand that radiologists are more technicians in terms of measuring curves, but they don't understand the importance of how their measurements can impact the psychology of a patient and parents, and also how it may actually interfere with the belief system that the curve is actually going down and the hope that's generated with seeing a positive outcome. So x-rays have to be measured correctly, and we need to know exactly where the angles are at the same levels of the spine and what's taking place: 38, 33, 32, 28, 29, 25. And in this bottom area in here, you could also do those measurements as well. But this curve has gone from a 39 down to a 34 degree. A 38 plus 28 is a 66 degree curve, down to a 33 plus 29 is a 62 degree curve, and down to a 32 plus a 25, which is now a 57 degree curve as well. So we need to know where the improvements are coming. So what I'd like to do is share with you a document which helps you understand how easy it is to measure from the top of the top top of the top vertebra to the bottom vertebra in order to get these angles correct. You shouldn't have any difficulty in using a protractor, and you should be able to know that you've got a lot of faith, a lot of confidence in curves that are actually showing decrease in very reasonable time frames, very exciting time frames. Going again from the 25th of April to the 10th of June, you want to see a 9-degree drop. Fantastic. We'll do that, but we want to have confidence in the x-rays. Click down below in the description box to understand how your x-rays are measured in a step-by-step format, and we'll be sure to send that to you instantly once you've given us your email. All right, thank you. This is Daniel Dahdah from St Jude's Clinic, and I hope your understanding of x-rays and the importance of x-rays, not just in determining surgery, because that's not the only reason for having an x-ray. There are better reasons, and that would be to determine if non-surgical means can actually show reductions and restore hope. Thank you. Bye for now.